talking about our patient rights. Our patients have a few rights that we need to respect. We have to care for them in a considerable and respectful way, and realizing that they're not just a number. Sometimes I think people get so busy in a healthcare setting and that patients become entitled by their diagnosis, and that's not how it should be. We should know them by name. We should know things about them so that we can care for them. When we care for a patient, before we walk into the room, we want to do a chart review. Is there any information that's going to change how we care for that person? When we are going to do a procedure with our patients, we want to walk them through what's going to happen. Before we even touch a patient and put our hands on them, we should tell them what's going to happen. The good and the bad and the ugly about it, because they need to know that. They need to be informed of what's going to happen to them. Sometimes I see that healthcare providers get so busy in their fast-paced environment that they don't explain what they're going to do, and they just assume that the patient knows. We can't assume. When we work in the healthcare environment, we speak a special language called medical terminology, or some people call it medical language. It is Greek and Latin. The layperson does not know those words. Now, if they're a healthcare provider and they come into our field as a patient, they might understand it, but we have to be able to relay the message in a format that they understand. We also want to have our patients be able to examine the cost of the healthcare services. If you've ever been in a healthcare environment, or got the bill when you're done. I know not too long ago, about 2 years ago, I had shoulder surgery, and all it was scoped. It was an outpatient procedure. When I started receiving those bills, I was astounded. I was thankful I had health insurance to help decrease the costs that were out of pocket for me, but it was still really, really expensive. And some people just can't even afford their deductibles for their insurance, and they need to be able to make that choice as well when we're working with them. We also want to involve them in their healthcare decisions. So give them all of the options. Sometimes patients will try to persuade us to make the decisions for them, but we can't do that in healthcare. We also have to understand that our patients are able to refuse treatments or procedures. Sometimes it's not what we would do as individuals in healthcare, but we need to be respectful of their choices. Sometimes people have an ailing illness and they choose not to receive treatment, and they choose to die naturally. That's their choice. Sometimes I think it can pull on our heartstrings as healthcare providers, but they get to have that choice. We can't take that choice away from them. When they are entered into a healthcare facility, whether it be a hospital or any other type of organization, we have to tell them the rules and regulations that govern that facility. Again, then they can make a choice if that's where they want to receive care, or they could choose to go to another hospital. They also get to freely choose their physician. We can't decide that they're going to see this specialist over this other specialist. They get to make that informed choice as well. They should be protected by abuse. Sometimes things happen where family members can abuse the patients. Sometimes I've seen that healthcare providers, because it's a stressful job, will sometimes say things that are almost borderline on verbal abuse. And also with verbal abuse, it's calling them by inappropriate names, using a harsh tone of voice. We shouldn't do that with our patients. We should care for them. We should also be on the lookout that if our patients are being abused by their family members or anybody around them, that we're mandatory reporters, and that needs to be reported up the chain of command. Our patients should be able to voice criticism. I know that I myself have gone to a clinic and set up a time for an appointment. I'm sitting there in the waiting room and the time is ticking away. I'm getting frustrated that, hey, how come they haven't called me back? And I do have the opportunity to voice my concern to, maybe it's the receptionist, and they should deal with it appropriately. Sometimes we as healthcare providers then need to look at our scheduling practices or how we treat our patients. I think in the past, healthcare has gotten a bad rep, and justly so. I know I'm in healthcare, but they did some things that were inappropriate. They acted like the patients were an assembly line, and that they were at the beck and call of the healthcare providers. We can't do that. We need to still be thinking about our patients. Now, there are things or times that in emergencies arise in the healthcare setting and that we can't control that our patients are getting backed up for their appointments. Also, when they're in the healthcare facilities, we also need to be respectful of their religious preferences and the social activities that they want to go and do, if they're able to. I know when I've been in a healthcare facility, having my children, I think it's kind of a boring place. And we provide TVs. Also, what we're trying to do is, Wi-Fi services so people can use their phones and computers. Think about the activities that you like to do on a daily basis. Now, in our intensive care units, which we abbreviate ICUs, we do limit the amount of visitors because of all of the actions that are going on and the safety of our patients. We have laxed a little bit with visiting hours. I know that when my grandma had her babies several years ago, my grandpa wasn't even in the room when she delivered. And my other grandma had him in her own home, and the doctor came to her. And then as the generations evolved, the significant others have been in the room. Sometimes we even see that because the culture and the value belief system of the person, that they have several people in the room when the birthing procedure happens, and that's their choice. We can allow it to happen. The one thing we do need to look at is if they're interfering with medical care, we need to bring that forward in a respectful manner.